Welcome to our webinar, The Basics of Medical Foods and Coverage Support Assistance, presented by Nutricia North America. Today we'll discuss the topic of medical food coverage and product fulfillment. In addition, I'll share with you a free coverage and fulfillment assistance that Nutricia offers to their patients called Nutricia Navigator. Before we dive into our discussion, let me start by reviewing a few disclaimers. The content of this program relates to enteral formula coverage in the USA. Production or distribution of these materials is prohibited. The information provided in this presentation is an overview and does not constitute product coverage or reimbursement advice. The purpose of this presentation is to provide examples of how to navigate the health insurance landscape. Information should not be interpreted as an endorsement by Nutricia North America, NNA, and does not represent Nutricia's position on sufficient or adequate coverage for medical completeness, accuracy, timeliness, or applicability to an individual's particular situation. All medical necessity determinations must be made by the responsible clinician. Determinations of coverage of therapeutic nutrition for an individual ultimately must be made by the appropriate health plan. Nutricia NNA does not guarantee coverage of any insurance plan provider and will not reimburse any claims denied by third-party payers. During our time together, we'll walk through a general overview of what medical foods are and dive into some of the challenges many caregivers face when it comes to product coverage and access. In addition, we'll review Nutricia Navigator and how the Navigator can help support you as you navigate the complex world of formula coverage. At Nutricia, we believe in the power of nutrition to make a positive and proven difference to health. Our products are medical foods and are designed to meet the specific dietary needs of patients in 4 key areas, including food allergies and related GI conditions, which includes formulas like Neocate, the area of inborn errors of metabolism, which include our metabolic formula range with formulas like Paraflex and Phenylade, the areas of the medical ketogenic diet, which includes our KetoCal product line, and our specialized adult nutrition category with products such as Prostat. I mentioned that Nutricia specializes in medical foods, so it'd be helpful if we take some time to review what medical foods are. Let's start with the definition. According to the FDA, a medical food is defined as a food which is formulated to be consumed or administered under the supervision of a physician and which is intended for the specific dietary management of a disease or condition for which the distinctive nutritional requirements, based on recognized scientific principles, are established by medical evaluation. So, what does that mean? Your child was likely recommended a medical food by your healthcare team because he or she was diagnosed with a condition requiring specific dietary management. Insurance coverage is probably the biggest challenge for patients needing medical foods because requirement is highly variable and there are many factors involved. That being said, let's dive into what those challenges are. The road to finding insurance coverage can be as daunting as the journey to get to the right diagnosis and find the right formula. So many questions, and many times, not enough resources to support your journey in finding the answers. Common health insurance challenges that we hear include, "My child was recommended this formula by their doctor, but now what do I do to get it covered?" Or, "I finally found a formula that works for my child, but the insurance denied coverage. Where can I go for help? I'm supposed to use a DME company to get my formula, but I can't afford my deductible. How are people supposed to pay for this? I have coverage for this formula through Medicaid. No one will sell me the formula because Medicaid doesn't pay enough." There are many factors involved in obtaining coverage. Coverage can vary based on federal or state laws, and insurance coverage can vary by payer and benefit plan. Some insurance policies may have exclusions or require prior authorizations. These are just to name a few of the complexities that may occur. So, how can you navigate through the complex world of coverage? By working with someone who's an expert and understands the process. This is where the Nutricia Navigator team can help. The Nutrition Navigator is a team of experts who are knowledgeable in understanding how to interpret insurance policies, documentation collection, and state and federal mandates. The Nutricia Navigator team has been finding medical food coverage over the past 10 years. They have a long history of supporting families find formula coverage. They help each family reach the best outcome for them and provide assistances such as contacting your insurance plan to verify you have coverage, assist you in appealing an insurance coverage or payment denial, help you understand where and how Nutricia products can be covered, work with public and private payers to find product coverage, including WIC, Medicaid, federal benefit programs, state-funded programs, and commercial plans. They can help advocate for insurance coverage by leveraging state and federal law mandate knowledge, initiating joint calls between patients, healthcare teams, and insurance companies to guide you through the process. The Nutricia Navigator will stay by your side until all of your questions are answered. Now let's review some key questions that you may be wondering about. First, who can benefit from calling the Nutricia Navigator team? Everyone. There's no age limit on coverage support through the Nutricia Navigator. We understand that many patients beyond the age of 18 require medical foods. Therefore, we don't limit our support. In addition, intake method doesn't matter either. We support patients who are both orally and/or tube-fed. Once you call the Nutricia Navigator team, you may have some questions already in mind, but we wanted to also provide you with some examples of common questions you can ask Navigator to help get your conversation started. We've bucketed them into 3 areas: coverage questions, where to get medical formula, and what if we have no coverage. Here are some examples. Do I have coverage for medical foods? What should I do if I don't have coverage? And where can I find the formula? When you call Navigator, be sure to have them explain some important insurance benefits terms that relate to your specific coverage. When the Nutricia Navigator team finds formula insurance coverage for you, here are some important insurance benefit terms to ask them to explain. Cost share or out-of-pocket. This is the amount you will need to pay in addition to your premium contribution. This amount may be capped. Deductible. Amount that you must pay before Neocate is covered. Copayment. The amount you pay monthly each time you fill your Neocate prescription if you're purchasing product from a pharmacy. Coinsurance. Percentage of the charge for Neocate. The Nutricia Navigator can help you find the best financial solution for your situation. There are times when running insurance benefits can take up to 2 weeks or longer. If the Navigator team is working on gaining insurance coverage on your case, they can access your individual situation and provide continued assistance to support your family as needed. Another question people may have is, what if my insurance company doesn't cover medical foods? If there are no coverage options available, the Nutricia Navigator team won't stop there. They'll help you explore other Nutricia formula fulfillment options. Some options to explore include an employer benefit through a health savings account, HSA, health reimbursement account, HRA, or flexible spending account, FSA. Or if your employer is not an option, you can purchase formula direct from Nutricia North America. To do so, please call 800-365-7354, or you could purchase directly online by visiting the websites on the screen. Please note that a healthcare professional authorization is required to obtain product. In addition, the Navigator team can help you explore available government programs, such as Women, Infants, and Children, WIC. This service provides coverage for specialized nutritional formulas for infants and children up to age 5. They'll also explore a program called Children with Special Healthcare Needs. Each state generally has a program established for individuals requiring healthcare assistance, and the Navigator team will help you assess them. You can ask the Navigator team about third-party discount programs that may reduce the cost of formula. The Navigator team will walk you through any currently available options. Lastly, depending on the condition of the individual, we have 3 assistance programs offered by the Navigator team when no other options are available, and if the family qualifies. Families may qualify at a discounted rate with certain eligibility requirements on a case by case basis. And finally, we wanted to provide you with information on how to contact the Nutricia Navigator team. Please note their contact information and availability on this slide. If you happen to call after hours, there'll be an option to leave a message. We welcome you to contact us with any Nutricia product insurance coverage and fulfillment questions.